Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 264 of the Ask Dr. Angela podcast. So much has been going on since we last spoke. Let's see, I've been to Mexico, Cancun to be exact, and it was like spring in Jersey 2 days ago, and now it feels like it's winter again. It was literally 80-something degrees on Friday. Saturday, it was a bit cooler, like the mid-70s, a bit on the breezy side. And today, it's like 40 degrees and raining. What happened? Oh my gosh. Anyway, let's jump right into today's topic, and it's on exercise during pregnancy. I've been getting a lot of queries about exercise during pregnancy. This week's blog post, in fact, is on exercise during pregnancy. So, Dr. Angela, do you recommend exercise during pregnancy? And my answer to that is, of course. There are so many benefits to exercising during pregnancy. I mean, the list goes on and on and on, but I'll give you 5 that just come right off the top of my dome. And they include the following. Exercising during pregnancy gives you energy. Who couldn't use a little bit more energy during pregnancy? I mean, pregnancy in and of itself, as beautiful as it is, and no one ever likes to bash pregnancy, and I'm not bashing pregnancy, but it's hard as hell. It's really difficult. It's exhausting. So exercise with, the release of those endorphins, i.e. those feel-good hormones that are released from a good workout, it will definitely help you to feel better. The other nice thing about pregnancy is it will help keep your weight gain at bay. I mean, the less weight you gain during pregnancy, the less you have to lose postpartum. But, keeping a good eye on the amount of weight that you gain can help with a couple of different things. Number one, it can help decrease your risk of ending up with a C-section. It can help prevent hypertensive disorders. It can also help combat gestational diabetes. And it also decreases your risk of having labor dysfunction. Exercise during pregnancy, speaking of labor, makes labors much easier. I mean, I know a lot of expectant moms that are very nervous and quite frankly scared of the labor experience, but let me tell you, when you exercise, that will give you the confidence to know that you can kick labor's butt. After all, if you're more physically fit, most of the time, and there's even some studies that suggest that you'll experience less pain during labor and you more than likely will have an even shorter labor. Let's think about what labor means. Labor means work. So if your body is already in shape, then your body will be capable of putting in the work required to get your baby delivered. Exercise helps decrease the risk of postpartum depression. That's a very real phenomenon in pregnancy, which is very stressful, overwhelming, especially if you're a first-time mom. So not only will exercise help decrease your risk of getting this, but it will also make sure that you get better quality sleep. Not only during the pregnancy, but afterwards as well. And I don't know any new mom that couldn't use some good sleep. And the other thing about exercise during pregnancy is, let's be real, if you're exercising during pregnancy, it's going to be a good way for you to continue healthy living. I'm all about lifestyle. And if you're already exercising during your pregnancy, it's going to be easier for you to continue that not only after the pregnancy, but throughout your life. And we all know about how beneficial exercise is to us with regards to decreasing cardiovascular risk. If you were someone that had gestational diabetes, it will also help decrease your risk of developing diabetes later on in life, etc., etc. So if you're not exercising, I would certainly recommend that you do so. If you're not someone that was previously exercising before you got pregnant, certainly check with your OBGYN to make sure that you are fit enough to undergo or initiate a new exercise program. And it's pretty easy, exercise in pregnancy. If you're feeling tired, short of breath, dizzy, lightheaded, you probably need to reel it in a little bit. Just make sure that you are staying hydrated. And did I say hydrated? That's today's podcast. So if you aren't exercising, I highly recommend that you get some. Thank you so much for tuning into today's podcast. I hope that it was beneficial to you. For those of you that have a query that you would like to submit to the podcast, you know how to reach me. www.askdrangela.com. That's AskDrangela.com. You can hit me up on any of my social media venues. That's Twitter, Instagram, Facebook. I'm all over the place. I'd like to leave you with this inspirational quote from my Congratulations Graduate book. I love this book. I think I got it I think I was in high school actually when I got this book, when I graduated from high school. But anyway, here's today's thought. Life's challenges are not supposed to paralyze you. They are supposed to help you discover who you are. Until next time, look better, feel better, be better. Can't wait to reconnect with you on episode 265 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.